Children from more than 500,000 homes in KwaZulu Natal went to bed hungry in 2018 alone. That alarming figure gives just a glimpse of the extent of the food crisis that's facing the youngest South Africans. Now, Spotlight, an agency that focuses largely on health journalism, has travelled to some of the areas worst affected. To unpack what the team found in KZN, I'm joined by Catherine Cleary. She's a journalist with Spotlight, live for us in our Cape Town studios tonight. Catherine, a very good evening to you and thank you for your time. I want to begin first with what you found when you arrived in KwaZulu Natal, because some of the children you spoke to shared harrowing accounts of how they've been affected by this food crisis.
Tembekile, what we found in KwaZulu Natal was probably one of the most extreme cases of vulnerability I've ever seen in my life. The child-headed households that we spoke to, these children some of them are no older than 13 and they're already living on their own. This one particular household we spoke to, the two boys are 9 and 13. They do not have parents. They're managing their own schooling, managing to feed themselves on very little money. Most of the people in the communities we spoke to live completely off of social grants. Unemployment is upwards of 80%. So we're really looking at deeply entrenched vulnerability.
As you speak of child-headed households, Catherine, I'm wondering about whether or not there is a clear ratio or difference at all in the suffering faced by child-headed households versus the other families in the communities.
Yes, so with child-headed households, I'm sorry, could you just repeat the question?
My question to you was about whether there's a distinct difference in just the levels of poverty between child-headed households and some of the other families. Is there?
Yes, there definitely is. In other households, you have parental figures, you have adults who most of them do not work, but some do have the opportunity to find other sources of income, whether it's selling fruits and vegetables on the side of the road. But with these children, they're really at a loss. There's not much help for them. Most of the help that they do find comes from NGOs in the community, community-based organizations that might give them food parcels, that might help them with their homework. But otherwise, extended family is also very far away. So these children are really living on their own. They really struggle in terms of finding their own voice and having leadership.
And these are children spread across some 753,000 households as of 2018. And sadly, in the South African context, there's a very real possibility that a great chunk of them will not be able to make it out of the cycle of poverty.
Yes, specifically in the area we went for our investigation in Jozini, when you're looking at figures of unemployment that are larger than 80%, you're looking at there's no job opportunities. Also, another issue that they face is water is very hard to access in these communities. So in some rural areas, you'll find that people do grow their own vegetable gardens. People sell those vegetables. People share them with the community. But even that's not happening in this community. So specifically with the children, those are the people that children are most affected by this crisis. If the family cannot put food on the table, if there's no water to grow their own food, children are really facing the brunt of this crisis.
And it does lead to death in some cases, Catherine, because you detail in your report how 75% of children admitted to hospital with severe acute malnutrition in KwaZulu Natal actually do not make it home alive.
Yes. So another startling statistic is that malnutrition actually accounts for 50% of hospital deaths for children under 5 in the country. So, I mean, we're looking at half of hospital deaths. Malnutrition is a serious factor in the fact that that child has died. In KwaZulu Natal, you have a 7.5% severe acute malnutrition fatality rate, which means that about just less than 1 in 10 children will pass away from severe acute malnutrition. But when we look at severe acute malnutrition, we also have to think about, that kind of hidden hunger cases. So we have to think about micronutritional deficiencies. We also have to think about overnutrition in terms of obesity, which the World Health Organization has said is one of the most hectic health crises of the 21st century.
Catherine, what options are there for an area like Umkhayakude, where you say there's the highest acute malnutrition rate, fatality rate, in fact, just over 11% of children there dying as a result?
In terms of solutions and interventions, community-based organizations are really doing the work that government should be doing in terms of reaching these vulnerable families, reaching these vulnerable children that really need help from the government, actually. But what really needs to happen is that a lot of stakeholders need to come to the table. So we need people to improve water infrastructure. We need funding for food parcel programs. We need people on the ground educating people how to grow their own food. We also need more active, deep community work in terms of educating people on proper nutrition, educating families on nutrition, children, and we need to really get more people on the ground to really understand the situation.
Very lastly then, Catherine, also quite dreadful, I found this quite disturbing, reading your report, was the fact that some of the feeding programs in KwaZulu Natal in particular have shut down over the years, exacerbating access to maybe one meal a day.
So I think what we have to look at is we have to look at the country as a whole. So economically, we know we're not doing well. Just today we found out South Africa is in another recession. So you have to look at where is the government putting money. Putting budget into feeding scheme programs and money that could go towards feeding communities doesn't seem like much of a priority. So you really have to look at how the government is prioritizing tackling these issues. But putting more money into feeding schemes, more money into food security and nutrition-related education programs could really go a long way here. But without job creation, without a focus on education, and without a focus on infrastructure, these children are going to continue to suffer.
Catherine Cleary, a journalist with Spotlight, thank you so much for being on Nightline tonight.